This conference will now be recorded.
Hey everybody, this is Dr. Doug Smith. It is Thursday at 2:30, so it is time for our Monday through Thursday 2:30 podcast. This is the podcast where you will hear the science about what actually happened to people during this opioid crisis. Great news today, and hats off to Alex. We're pretty much ready to, we're ready to submit everything to the FDA. We're waiting on a form 1572 from the principal investigator. He promised me last night. I was expecting it last night. And so hopefully we'll get that today and get everything uploaded over to the FDA. We'll know everything is uploaded when we get what's called an acknowledgement letter. And that starts the 30-day clock. The FDA has 30 days to reply to our submission. And they take that seriously. We will hear from them within 30 days, usually on the 30th day. And so we expect to hear from them within 30 days. I mean, quite frankly, if you don't hear from them within 30 days, what that means is your proposal was accepted and you're free to begin your clinical trial. If they turn us down, like they have 5 times in the past, well, now that Alex and I have really learned this process, and we're not relying upon outside consultants anymore. We know how to pretty rapidly turn a proposal around in a couple of 2 or 3 days and just get it resubmitted. And that's our plan. They turn us down, 2 days later, we resubmit. 30 days later, they turn us down. 2 days later, we resubmit. 30 days later, they turn us down. And we're not going away. And that's the whole point. We're not going away. Okay, they'd love it if we went away. Okay, but we're not going away. Okay, we're going to get approved. The science is just too heavily on our side, and the fact that they're ignoring the science. I think the book, if we have to, the book will help us quite a bit. But let's see what happens here. Pretty excited about the whole thing. Why does this matter? Why does submission to the FDA matter? Why should you care? Why should a listener care? Okay, valid question. Let's talk about that. Why should a listener care about us making a submission to the FDA? What does that mean? Well, what we're submitting for is called a phase 3 clinical trial. Okay, and we will get approved. We're asking to use buprenorphine, okay, for the symptoms of the genetic toxicity. Okay, for the symptoms of the genetic toxicity. We proved in our first clinical trial in 2022 that when people get sick, when they go into opioid withdrawal, what we call the signature disease, they get sky-high levels of adrenaline, catecholamines, epinephrine, norepinephrine, dopamine, what most people call the adrenalines. And the FDA's ignored that in the past. The psychiatrists have ignored that. That's a big part of the book, is that ignoring science is a bad idea. And so we're asking to do a phase 3 clinical trial with buprenorphine to show that buprenorphine will normalize the adrenaline levels. Okay, we know it will. We just got to do a clinical trial to prove it. Now, again, why does that matter? Why should the listener care? Because once we're approved for the phase 3 clinical trial, that makes us eligible for what's called the treatment IND. Treatment IND, treatment investigational new drug. And you can Google treatment IND, and you'll see that it is a regulation of the FDA, something that the FDA allows, and it allows for the treatment of an unlimited number of people. And that's what we want to do. We want to use buprenorphine for the treatment of an unlimited number of people and turn this opioid crisis around. Okay, what you're looking at here is our plan of how to save lives. That's what this is. This is our plan of how to save lives. Are we our brother's keepers? Yes, we are. And we take that very seriously. And we've had a lot of headwinds against us. We've had a tremendous number of headwinds against us. Okay, and as you'll hear me say, we never ask that the headwinds be removed. We just ask for the strength to get through the headwinds. And so far we have, and we're going to continue to get through the headwinds, no matter what they throw our way. We're not going away. We will get this phase 3 clinical trial approved, and we will get the treatment IND approved, and we will get this ridiculous opioid crisis turned around, and we will smash the fairy tale that is opioid addiction, opioid use disorder. It's a fairy tale. Okay, there's no science involved in a fairy tale, and there's no science involved in the diagnosis of opioid addiction or opioid use disorder. The book is going to be, I don't know, 280, 300 pages long, maybe 320, something in that range. And the book goes through exquisite detail of why that statement is true. Okay, there's no scientific evidence to support the diagnosis of opioid addiction, opioid use disorder. Why is that true? The book goes through it in exquisite detail. By the way, a lot of that evidence is on the screen in front of you right now. Okay, take a look at what's on the screen in front of you right now. That is our first citizens petition. We've submitted two. Okay, the reason that we went the route of the citizens petition is because the FDA had denied our clinical trial. Okay, so this is the first time that we've submitted for the clinical trial once we have submitted and gotten the citizens petition published. That's what's different about this. Okay, what we're doing here is we're making it much, much harder for them to deny the science. Okay, that's what we're doing here. We're making it much harder for them to deny the science. And that's something that we had to do, is make it as difficult as possible for them to deny the science. So I tell you what, we'll hold here for now. Everybody have a great week. Everybody have a great weekend. Let us hear from you. Email, text. Let us hear from you. And hopefully, when we get back together on Monday, we'll talk about the fact that our FDA submission has been received by the FDA and the 30-day clock has started. So as always, don't forget to like and subscribe to us. Don't forget to post this podcast on your social media, everybody else's social media. Okay, once we get this FDA submission behind us, Alex and I are going to catch up on a few things, one of which is getting our first series of emails out to the people who have signed up to be in the first wave of mass tort lawsuits. So everybody have a great weekend. We will see you back Monday. Alex, as always, thank you for everything, my friend.